Hello everyone. Good afternoon, and this is the last session. So it's very good to have you all of you still here. Okay, let's go to my parts. Okay, Dr. Qi have introduced very interesting use cases. Use Gen AI against our EHR solution here. I will give you another product. Based on Gen AI and run against our HealthShare EHR solutions. So we will go back to doctors' daily life. As a doctor, we need data, especially clinical data for patient care. If for missing important data means risk on patient safety. So EHR actually connect different data sources and bring together different things. For example, care delivery, care coordination, health plan, and even third-party data. So we bring together all of this data together and generate a unified care record. For healthcare, actually, our data volumes increase very fast. We are top one, the data volumes increasing industry in the world. Some consulting company estimated about over 10,000 EB in this year, compared to about 2,000 EB in 2020. So we have year-of-year growth about 36%. More data doesn't mean better care. It often means data overload. So many studies shows data overload frustrated doctors and cause them burnout. So this is a study shows over 6% of the doctors feel so overloaded with information that is increase their stress level. And 30% of the doctors, they think information overload is a contributing cause of their regular burnout. So that means a lot of data cause a lot of trouble because too much data, too much noise. Doctors need time to find out what's really relevant. Okay, so data volume actually is just the tip of the iceberg. For EHR product, it's facing lots of challenge. So besides traditional data quality issues, nowadays we have so many data and data types. It's very complex. And we are facing there are other things. For example, facing semantic difference. So, for example, different terminologies, different units, and different data granularity. For doctors, actually, they need a problem-oriented view to show what matters and why it matters. But EHR solution always struggle on how to present data in a way that is truly relevant and intuitive. So here is HealthShare clinical viewer, our viewer of today. So you can use this viewer to filter data. This one is filter data by encounters. You can use our filter to highlight some abnormal lab results, for example, this one. And we can give the trends across facilities. And we even give some problem-oriented groupings. So this is what we do today. It resolves something already. For example, it's for semantic difference, it improves the semantic a little bit, and it resolves the data usability a little bit a while. But it's still facing the major challenge. The major challenge is how to give the doctors a real relevant data in a intuitive ways. So how AI can help? As we know, AI actually played a very important role, even game changer in many industries already. So could we use AI to help resolve the health data overload? we built a solution. We call it AI assistant. It's an AI-based chatbot based on HairShare. It's used HairShare unified care record as a base. So we just apply good, very simple chatbot for users. Users never use. They don't need to use the clinical viewer to navigate the data anymore. They can use the AI chatbot. And how it works, I think both Gökhan and Martin give you a very detailed technical knowledge on this part already, so I just ignore this part. So I will give you a very quick demo. So considering we have a patient, Michael, he came in for his unstable blood sugar. He has years of visits across multiple facilities. So the doctor used our clinical viewer to view Michael's data. Okay. So there we have a group the data into categories for easier navigation. But doctors still need to go through many pages to find out diabetes-related information like diagnosis, like medications, like lab results. A lot of things need to go through it. You see many things. It's quite time costly. So that means it's very easy to cause the patient burnout. And it also increases risk to overlooking for important information. So let's see. Doctors really spend a lot of time on this. It's still looking for data. Let's read well. Okay, so this is for lab results. For the lab results, there's even for different units. So it's very hard for doctor to see clear trends. Okay, so like this. So the doctor decided to use AI assistant. So he switched to the AI assistant. In here, he just asks questions. The first question is just ask all the information related to the diabetes. So he asks summarize diabetes-related data and build a problem-oriented timeline. So from now on, I did speed up because the AI assistant is very fast. So it lists all the information about the users, patients' diabetes, a lot of information. And here, because of the unit difference, so the doctor decided to ask question, plot all blood sugar-related methods and make sure to normalize units. Now the AI assistant just gave the doctor normalized lab results with same units. And the doctor also don't want to miss anything behind the blood sugar swings. So he asked another questions. His question is check for medications events that can worsen the blood sugar control in past 3 months. So in this way, AI assistant just flagged 2 drugs. These drugs known for diabetes treatment, but they can potentially explain why the patient blood sugar rise. So here lists very detailed analysis. So in this way, you can make sure AI can help doctors to prevent any missing information for the patient records. So this is the AI assistant, how it works. So from this quick demo, we can see AI assistant plus our unified record can resolve many things. It can cut through the data overload, can bridge the semantic difference, and give the doctors a very simple and intuitive chatbot to ask questions. So doctor don't necessarily to use a clinical viewer to go through many pages to find relevant data. But could we trust HairShare AI assistant considering AI hallucinations? Could we protect data privacy and prevent the data leakage? So this is InterSystems AI principles. So we call it the safe AI principles. We follow this 6 principles. I think you guys have seen this one in the morning session on Dong session. He mentioned that already, so I just skip this slide. So let's have a look. The first thing, the most important thing is that we need to make sure, okay, HealthShare AI assistant doesn't give you AI hallucination. So let's ask AI assistant a question. We ask a situation that the patient does not have. So we go to the AI assistant, ask a question. Okay, so here we ask a question. We ask to please summarize our data related to the patient heart failure. Actually, the patient have no heart failure at all. So AI assistant give you correct answer. It said, okay, no data found because the patient actually have no this condition at all. And it's also lists all the data source, so clinician can make sure, okay, we have give AI or assistant a correct answer, correct data. And you can see the audio log. Audio log shows you all the details, information about request and response. For example, for the data sent to large language model here, for patient ones, you can see only very limited minimum data sent to large language model. No sensitive information like name, identifiers, telephone number, address, these kind of things. It's also applying to other data types. So how we can control the data sent to large language model? Actually, admins can use the data definition. For example, for demographic, you can see many sensitive information are unchecked. So that means this data will not assign to large language model. It's also applied to other, for example, encounters. So let's have a look on encounters. For encounters, for example, for the doctor's information also blocked. So doctor information also will not assigned to large language model. So in this way, we can make sure, okay, we keep the data privacy and we will avoid AI hallucinations. Okay, so this is HealthShare AI assistant. So when we have it, let's have a look on our roadmap. So we plan to release the first version in this October. In this release, we will provide text-based chatbot. We support structured data. And we will have the next release. In this release, we will support more features. The first one is we will support unstructured text. And we will have embedding and vector search. And we will have voice-based chatbot. And we will have a graph output. So this is our plan. This is AI assistant. So thank you for your attention.
In the meantime, myself as an engineer, I also have a question after I saw the presentation from the speakers. I'm curious to ask QP, to ask Qiao Peng about the HealthShare AI assistant that he shared here. It's a very wonderful product, and it will streamline the workload of the physician itself. But how do you gain the trust from the physician to use the HealthShare AI assistant itself?
Okay, I think it's a very good question. So I mentioned our safe AI principle. I think the principle mentions several very important things. The first one is human oversight. Another one is editability and correction. So that means actually the decision is made by a doctor, not by AI assistant. And another one is data transparency. So that means we need to let doctors understand, okay, what kind of data we assign to large language model and what response we get from AI assistant. So these are all traceable. And the last one is consistency. So that means the AI assistant should give consistent answers. According to the demo, and I believe you have saw it already, so we have an audit log for all detailed information about request and response. So this gave a doctor clear information about what kind of data was assigned to large language model and why large language model gives this response, especially considering the data scope. Actually, the data assigned to large language model is what allowed the doctor to see. For example, if the patient decided some sensitive information were not disclosed to this doctor, the AI system also will block this information. So that means in the AI system just use the data who have the permission to see to the large model. So this is the first one. The second one is consistency. So that's why we evaluate every large language model. So for the first release, we will support OpenAI because we tested it thoroughly to make sure it gives persistent result. So this is the answer for this question.
Thank you so much, QP. To summarize a bit about QP answer, sorry, Qiao Peng answer. I keep calling him QP because that's his nickname. So to answer my question about how to gain trust from the clinician or the doctors itself, once again, if healthcare AI assistant is just a tool, but the data still belongs to the owner, may it be hospital, the doctor, or the patient, and they still have the control over which data are being able to send to the AI and which data cannot be sent to the AI, and that can help to build the trust of the user itself. We have time to get another one question before we move to the main room. Is there any question from the floor? If not, I have another question, and this time is for Dr. Torikai. I'm interested to ask you because I saw in your presentation that not only in Japan, but you also look at the trend of healthcare in all the Southeast Asia and Asia country. So looking ahead, what do you see is the next thing in the data interoperability in healthcare?
Okay, so thank you for the question. So the digitized countries, the already digitized countries, so for example, Americas and European countries has the same problem. So I would say the point of view that the regional health is not fit for the economical cycles. So as for the current, so because our health shares or digitized IT information network is the more expensive than the paperwork. So the paper is very powerful tools even now. So that is a viewer, and that is the editor, and that is a record. And we can copy it very easier, and we can see it everywhere, and it lasts for a long time. So in contrast, the digitized tools. So do you know the lifetimes of the iPhones? Not longer than 10 years, and our hardware should be replaced 5 or 7 years, so not so long time than the paper. And but it needs the basic medication needs lies in regional health, and the regional health economics is not so the current problem of the Asian countries, so but it's all of the world. So we already know that the local effort for the making the economic balance better in the regional health. The most of the regional health trials that failed. So I want to emphasize the last slide, the message. So in order to fulfill the regional health economics, maybe I guess that all of the clinicians in the world makes the effort to contribute to enhance the more the good and reliable and have a long time life, so software life. So our challenges should be the very big, but so each person's contribution should be very important and valuable. So that is my prospect.
Thank you so much, Dr. Torik. I couldn't agree more with your answer that it's always the 3P, people, process, and technology. And that concludes today's track 2. Thank you to all our speakers, and thank you to you all, our audience.